We'll call this meeting of the Central Nevada Health District to order. I'm Mayor Ken Tedford, and at this time, if you'll all rise as we pledge allegiance to the flag.
This conference will now be recorded.
I pledge
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Once again, I'm Mayor Ken Tedford, and I'll be chairing this meeting. Item 3 on the agenda is verification of the posting of the agenda has been posted in compliance with NRS.
Yes, Amber Edwards, for the record, verifies that the agenda for this meeting was posted on the 8th day of August 2025 between the hours of 8 and 9 a.m. at all the locations listed on the agenda.
Thank you, Amber. Could you now, Amber, on item 4, take roll, please?
Yes. Chair Ken Tedford,
Here.
Jim Barbie,
Here.
Justin Heath, Bob Erickson,
Present.
Denise Ferguson,
Here.
Don Witten,
Here.
Brandon Chaddick,
Here.
Jeb Rowley, Nicole Cooley, Connie Gottschalk,
Here.
Tony Roos.
Here.
Okay, I think that will determine that we have a quorum present. Thank you.
Yes.
We'll go to item 5, public comment. There's one also at item 19. Public comment must be general discussion only. No decision can be made. Is there any public comment? None. We'll go to item 6. Item 6 is approval of the agenda as submitted or revised. Do I have a motion to approve the agenda?
Bob Erickson, for the record, I would move that we approve the agenda as submitted and posted.
Do I have a second?
Connie Gottschalk, for the record, I'll second.
We have a motion, a second. All in favor?
Aye.
Aye. None opposed? Motion carries. We'll go to item 7 on the agenda, which is consideration and action on the approval of the minutes of the meeting held on June 26, 2025. But before we do that, I'd like to offer an amendment to those minutes. We don't have in those minutes the members present and absent. I think for the record, the meetings needs to show who was present. I will read into the record who was there and also who was absent. Those present were Chairman Ken Tedford, the Vice Chairman Justin Heath, County Manager Jim Barbie, Member Bob Erickson, Don Witten, Jeb Rowley, Nicole Cooley, Brandon Chaddick, and Connie Gottschalk. Those who weren't there that day were Denise Ferguson and Tony Roos. If that record seems to reflect to the board who was there that day, I would like to offer that amendment to the minutes as you review them today for approval.
Mr. Chair, I would move to approve those minutes as amended.
Mr. Chair, Bob Erickson, I second the motion.
We have a motion and a second to approve the minutes as amended. All in favor?
Aye.
Aye.
Any opposed? None opposed. Motion carries. And the minutes as amended for June 26, 2025 have been approved. We'll go to item 8, consideration and possible action concerning the presentation by Dr. John Packham, UNR School of Medicine, Nevada Health Workforce Research Center on workforce report findings. Doctor, welcome today. Thank you for coming.
Good afternoon.
Right there. There you go.
Got it, okay.
Ready to go now. Thank you, sir.
Advanced education paid off. I'm for the record, John Packham, and as was noted, I'm Associate Dean in the Office of Statewide Initiatives at UNR School of Medicine. I've been there about 25 years, and going back almost 20 years, some of my early work at the school was working with this community to try to stand up a health department. So anytime I am given the opportunity to come back and speak, this was just one of the great things that happened coming out of our office, is to assist when you guys were needing it, and glad we played a small role in that accomplishment there. Shannon asked me to come and share a report with you, and it should be they have copies of this? Yeah, if you're having difficulty sleeping tonight, just pull out this 70-page report and thumb through it. But in seriousness, it's something our office does every a couple of years, is we do a refresh on this report to highlight where we've made gains in the state in addressing workforce shortages, the work that remains before us in that. And typically when I come to a rural community, it's not a great story in that this county, as this report documents, faces serious primary care, dental and behavioral health shortages. That may not be new news to you, but I think it's always important for us to document that, again, where we've made progress. In some areas we have. If you take behavioral health, for example, the state's made enormous progress in increasing the supply of social workers, marriage family therapists, counselors, and the like, but there's still critical needs in clinical psychology and psychiatry and so forth. So those challenges are pretty daunting, and I know firsthand that communities like Fallon and Churchill County, you are competing for scarce talent and health professionals with urban areas in Reno and Clark County and so forth. One of the things that my office has done over the more than 3 decades is think of not just diagnosing the problem and being the bearer of bad news on workforce shortages, but also trying to come to communities with solutions. And so a couple of those solutions, or at least things that I hope you consider as resources, one is, and I've got a single-page flyer here, a handout, on the Nevada Health Service Corps. This has been in existence since 1989, and the idea is real simple, and that is if you can offer student loan repayment forgiveness for individuals willing to serve in a medically underserved area, such as Churchill County and Fallon, will offset some of those student loans that you've acquired. I don't know a health practitioner that was trained in the United States that doesn't have some form of student loans and so forth. So I wanted to share this flyer on a loan repayment program overseen by my office, and on the backside you can see a very long list of health professionals that are eligible for loan repayment support. And I've also got a rock star in my office. She's actually in Elko, Alexis Kirby. Her information is on there, and please reach out to her. Denise, I don't know if I assume you've got multiple providers that have benefited from the program as well and can speak to it. But one of the things I love about this program, I looked at the data, I double-checked, I triple-checked the data. Approximately 95% of the individuals that have received loan repayment support through this program have completed their service obligation, have remained in the state of Nevada. 75% have stayed in the community that they completed their service obligation, even better. And so it's a program that works. It's not going to be the be-all and end-all to your provider shortages and so forth, but I think it's, again, an important thing that I always want you to be mindful of. I would also want to mention in the same vein, the Treasurer's Office provides a loan repayment program that kind of parallels ours. And we worked closely with the treasurer after that was passed in 2023 to implement that. See what ways could that complement professions or areas that our program is not. My program is a joint federal and state partnership, and they put some restrictions on what professions we can support through loan repayment. Really great thing happened in the legislative session where the legislature added public health professionals that are employed with a state or local health department as one of the eligible applicants. So I know you're in the process of a search for a district health officer. If that individual or applicants for that position are coming with student loan debt, that's one more item I think that you could use to seal the deal on your best qualified candidates. So please consider that. A second thing, and this happened last week, so my timing is excellent. We learned that a grant that we applied for with Banner Churchill Community Hospital and then our Office of Family Medicine at the School of Medicine received a 3-year grant of $750,000, $250,000 in each of the next 3 years to begin planning for a rural residency program, a family medicine program. It may not necessarily be squarely within the purview of the health district, but many of the particularly preventable health conditions and this community's periodic difficulties in recruiting and keeping family medicine docs. Again, this is one of the best practices and models that you could ever come up with. There's been a family medicine rural residency program that was established in Winnemucca, and they've done a great job of keeping those 1 or 2 docs that come out of that program every year. Some of them don't stay in Winnemucca, but I was actually in Ely last week, and Matt didn't poach that doctor, but we consider that a win if we can educate and train a family medicine physician and then get that rural experience in the last 2 years of that rural residency program. If we keep them in Nevada, Packham anyway considers that a win. And so this has been a long time in the making. It's kind of stopped and started over the past decade, but again, we submitted the application, a very competitive grant program, and we were notified last week that that came in. And only in the only fashion that the federal government can do, we got the award a couple of days ago, and they said, by the way, this starts on August 1st. So I guess we go back in time to start working on it, but better late than never. A nice little feather in our cap. One of the things, and I don't want to get ahead of us, there's a lot of work to do on this rural residency planning program, but it puts this community even in a better position to receive additional federal grant money once you have that program established here. So I'm quite bullish on the potential for success with that particular program. The last thing I wanted to share with you, because it's actually more germane to the work of the Central Nevada Health District, is a report that our office put together for all 17 counties of Nevada. It's this document here. I will leave it to you to read, and I'm happy to come back and spend a little more time, particularly with Health District staff, on the findings of that report. But it's a really rich data source and data release on an annual basis from the County Health Rankings and Roadmaps project from the Robert Wood Johnson, supported by the Robert Wood Johnson Foundation. But it gives you really nice granular data on close to 100 public health measures. It allows you to see where Churchill County lands, and I'll just give you one example. Try to find a good one here. The ratio of population to primary care physicians. It allows you to benchmark. You have approximately 2,100 residents for every primary care doc in this community. The Nevada average is 1,700 residents per primary care doc, and the U.S. metric is 1,300 residents. So there's plenty of work to be done. The timing of that family medicine residency could not happen soon enough, but in considerable detail is a very rich source of data that as you assess what community needs are, where do we stand versus other Nevada communities, and where do we stand across the 3,000 plus counties in the country, a great source of information. It's a good source of information, not only identifying gaps or problems in health and public health, but where you've made progress. It provides longitudinal data. We're actually doing a community assessment with Denise's facility in Hawthorne, and this is one we tap into. Really, really rich there. And I believe with that, I'm happy to address any questions you might have for me. But again, appreciate the invite and coming out. And please consider the Office of Statewide Initiatives a resource in the work that lies before you.
Hi, John.
Yeah.
For the record, Denise Ferguson. Thank you. We've used this program exclusively for 5 years, a lot more than some of the others, and we have seen the absolute benefit of tenure. People that weren't planning on sticking around have actually been with us for 5+ years in licensed roles that are hard to fill. So huge benefit to us, and I definitely appreciate how much your office is willing to be creative with me at times, because I tend to ask for a lot. But I guess the question I have when we talk about behavioral health, especially here, is, and yes, you can get the MFTs, and we can get social workers, and we can kind of grow those organically in the state. But like you said, the psychologists and psychiatrists, is it that we're missing like the specialty program? Is the GME approval kind of in the state going to allow us to do some more of that? Do you see some of that as a pathway in the future?
Possibly. Now, this one is set up explicitly for family medicine. There are rural residency programs and graduate medical education programs that are eligible to make it a rural psych program.
Okay.
That's one that we've approached with a little trepidation. It's like, can we get a handful of family medicine rural residencies established before we go after psych? It's a really tough nut to crack. But with that said, and again, the federal grants landscape is, I'll put it charitably, it's chaotic right now, and so we don't know what's coming down the road. But some of the things that the federal government has offered in terms of rural health workforce development support is grant funding. We have one right now that improves the ability of primary care docs and providers to provide OB-like services, and extend that, particularly in communities that have difficulty supporting one obstetrician and gynecologist. So they're called workforce enhancement grants, and I think that's a route that would be great for you in the area of psychiatric and mental health services. It's not to say that you're turning a family medicine doc into a psychiatrist in the afternoon, or anything like that. But anytime we can enhance the capacity of local providers to treat and manage as many patients as they can, keep them in the community, keep those dollars in the community in terms of reimbursable services, that's kind of our interim step.
Thank you.
Yep.
I appreciate it.
When you hit primary care, dental, and mental health, dental surprises me a little bit.
Yeah.
It just does, but, I don't have the facts at hand that you do, but
Yeah.
primary care and mental health are like, they just scream out here.
Yeah.
And I think in maybe the other communities, I'm not sure, but
Yeah, one of the things I would say about dental health is you may have a good complement of dentists here in Fallon. I don't know the specifics on that, but one part of that designation is just not simply how many providers do you have per capita in a community, but it's an attempt to also estimate how much oral health care needs you are. Every community has an economic demand for dentists. What will insurance cover? My plan is awful in that regard. What out-of-pocket expenses do you have? What percentage of elderly and low-income kids in poverty, for example? So it's not just provider to population, but it's also, what is our attempt to estimate what's the level of unmet oral health care need.
get
in
that,
Center.
yeah.
And that's probably why that might be a surprise.
And I don't know the other counties either.
Yeah, pardon?
I don't know the other counties, how.
Yeah.
how
Well, we
that
have
look.
one rural county that's not shortage designated, and that's Eureka. But what I tell anybody that I speak to on that community loses one dentist, they flip back into a shortage designation. And now the opposite can handle too.
Yeah.
Getting one dentist in most of our rural counties, it can be a game changer. So,
The primary care, you were pretty familiar with that, been a real problem here for a long time, and I've sat on the hospital board for a long time, and
yeah,
I sit on that rural residency board, so we were very excited to get the $750,000 to really get that program going.
Yeah.
So we're pretty excited about that. And Ted's on it back there, Dr. McDonald. So I'm wondering how this money, these grants can dovetail into that program. I was unclear about that.
I'm-
The Nevada Health Service Corps,
oh, those are actually two very separate.
I get they're separate, but can they somehow work together with these?
Absolutely. So the good thing about Nevada is that the rural anyway, the number of hospitals that we work with 13 of the 14 hospitals primarily, and the way that program has worked historically is when Rob here in Fallon is trying to recruit any number of the professions listed on the back, one of the things he typically does is, I'm this close to getting a physician, or I'm this close to getting a director of nursing. Do you have available Nevada Health Service Corps funds? And if we do, we typically exhaust these. There cannot be enough dollars in this space. It's a way in which, we can, again, kind of help seal the deal. And that would also apply to physicians who might be instructors in this new rural residency program. And as I mentioned, our loan repayment program out of my office doesn't support loan repayment for public health professionals, but those dollars exist as well. And so it's part of many things that we're trying to do at the same time to get providers in your community and keep them here. The loan repayment's really on the retention side of that.
I kind of understand that because I know how the lawyers kind of work.
Yeah.
If they are out working in the public side, it helped pay back some of their law school
Yeah.
debt, for so many years they
Yep.
work or whatever. I don't know it totally, but, I had talked to Jim once when he was county manager that, maybe the city and county had to pool some money together to help pay some debt for a doctor to get them here to help Banner, land them, and then hopefully they stay, like you're talking about, doctor, in the community once they grow to love it, once they get here.
Yeah,
The mental health part is, as Shannon knows, that's a big issue for me, that it's a thread in almost everything you see in our society, that goes on.
yeah,
I've probably been in, 4 or 5 meetings this week that mental health was an issue and was discussed, and it was the root of a problem. And it's touching on what Denise said. It's like you need to go a little bit beyond just the counselor stage, sometimes I feel like I'm the counselor, when you're talking to somebody, I'm totally not equipped to do that.
yeah,
And you want to hand them off to, and there isn't anybody I know the 2 big counties have lots of higher level mental health people, but they don't have enough. I get it. It's a shortage in our entire state, but the 15 rurals are having trouble, We really need to, somehow get beyond that. And if we could somehow help educate someone and bring them home, and maybe Central Nevada shares this person, in the 4 counties in the city of Fallon, because one of us can't support one by themselves. I don't know the solution, but I know the problem.
Yeah,
And the counselor level is just not quite enough to pierce the mental health issue. The talking stage like me, certainly not enough.
yeah.
And when I try to hand off to a counselor and they say, well, I can't find one, I mean, a psychologist, I guess,
Psychologist, yeah.
Now, you need counselors, you need prescribers, you need,
There's a whole network.
you need the whole network.
And that's what Shannon and I've talked about for a long time and she's working on that to try to support us here, but man, it's just overwhelming and it
It is overwhelming, and I,
get so deep in these folks' problems that it's hard sometimes,
yeah.
John?
It is overwhelming, but I would say that one of the promises of establishing a rural public health department is that you can at least begin trying to direct more attention upstream. You guys deal with mental health issues in your jails. You deal with them in your ERs on a daily basis. You deal with them all downstream once they've reached a crisis point, and it impacts probably every sector of your public government in this county. And there are some solutions that have you looking upstream in the first place and addressing some of those determinants before they reach a crisis point. I would also say the solution is not simply health workforce, but that's a critical part of it.
Well, families should solve a lot of problems, and they do, but sometimes they're just too much for a family to be able to handle
Yep.
some of these mental health issues. That's when they need professional help, and when they ask for who do I go to, there's not anybody there. That's the hard part for a rural, I think.
Do both of the schools in Nevada, do they have a psychology or psychiatry program?
Yes.
Okay, so,
And one of the big problems, and we tried to address it this session, and it did not get any traction. One of the barriers in clinical psychology is simple placement sites.
Okay.
We graduate a good number of individuals who are prepared for licensure once they complete their clinical training, but they're leaving the state and they're staying out of state. You do your training in Colorado, you discover.
you're going to stay there.
Why do they go out of state for that?
Because we just have a very limited number of approved clinical training sites.
So it would be good or inherent on us to be connected with those departments so we could find out how we can be one of
Yes.
those.
So they don't have a mentorship in Nevada,
Or enough of them to meet the demand of the students coming out.
Yep.
so it's like
It's just a bottleneck.
the licensure place, the person that oversees them while they're in their training.
Yeah. Well, and there's just a bottleneck. So you complete your didactic and your educational training in Reno or Las Vegas, then you do your clinical training in a real-world site under the supervision of another clinical psychologist. And it's
Okay.
analogous to the problem we have with graduate medical education in the state of Nevada right now. We've added a public medical school in Las Vegas. Turo spits out 160, 170 DOs every year, but we don't have enough graduate medical training opportunities. And so what I see every year when I survey those grads is about 25 to 30% of them leaving the state, and when they leave the state, they don't come back.
What about if in that link, doctor, you were an entity that paid when they left the state?
Yeah,
That link there, you paid for that training. You paid for them to live. You paid for them to be under that clinical psychologist
yeah.
with the understanding they would come back here.
That's actually a possibility. there's not too much of that activity taking place.
Instead of
but it
relying
does
on
take-
this, the
yeah.
entity, you know, like Jim and I were talking about, the city or the county would pick up that tab
Yeah,
with the understanding of you come home, or you come back to Fallon, you know.
And
Years of indentured service.
Yeah, something.
Well, and I mean,
Yeah,
Well, we
like,
wouldn't call it
may not
that,
be
but yeah.
legal, but I
Yeah.
don't know. I've never run it by a lawyer, you know,
Yeah.
we were just talking at lunch.
And even at the Winnemucca Rural Residency Program, even though they're in there for a couple years, they're already committed to somewhere. Even when they're in Winnemucca, they have a job,
Yeah.
usually in the first year, and they're getting a salary from whoever they're committed to, so that is already in that program.
Yeah.
I think if you have clinical psychologists that we could partner with that are in areas, because obviously you have to be a clinical psychologist to be able to be a mentor or mentee in that program, and it's not in our rules, then we'd have to find ones that we want to partner with, maybe in the urbans, but we would do something to support their payment. I think we could do that for them to be more cohesive in wanting to accept them.
Maybe you'll have to go back, not when they leave, to go to the clinical psychologist, the mentee thing. You start paying like this service score when they're back in undergrad or they're in medical school. That's when you start paying.
yeah.
And then they become your indentured servant earlier. I think these things are possible. I just don't think we talk about them.
I think they're 100%
Because
possible.
you have a problem, you gotta solve the problem, and you have to be innovative to try to do it. I don't know how that works, you know. I don't even want Jeff to go on the record today over here to say anything from the legal standpoint. It's just frustrating when, you know, you talk about it a lot, Doctor, but when you read it, when you have it in print here, it just jumps out at you more. And
Yep,
yeah, I'm sorry to delay this so much with that discussion, but I really appreciate you coming today,
absolutely.
and I really appreciate this information. And I've already started going to sleep through your 70 pages. I
Well,
didn't
hopefully
quite make it
somewhere
all
in
the
there,
way,
I'll
but-
leave it with the secretary, but my contact information, please reach out. If
Yeah,
there's
no, thank you
anything
for
we do
that.
to clarify it or provide more detailed information on what you're facing in Churchill County and the counties that make up the district.
I appreciate that, thank you.
Yep.
Any other questions? Any from the public? Being none, thank you very much.
I'm going to leave you with one last thought now that it occurs to me. I'm working with Denise and Brandon in Pershing right now in community needs assessment. It's not the whole catchment area of the 4 counties, but we should have those assessments completed by the end of the calendar year. I'd be more than happy to come back and give you a quick overview of what we found. I think it would inform
I
your
think
work.
that'd be good.
Yep.
Yeah, I'd appreciate it.
Right. Thank you.
Okay, thank you. We'll go to item 9, consideration and possible action concerning the review and approval of positions, job descriptions, and salaries for the administrator, health officer, health services officer, and public health program coordinator. Review of updated job descriptions for the clinical manager, public health investigator, environmental health specialist 1 and 2, and public health planner to support the new organizational chart, and authorize the human resources and interim administrator to present all to the Board of County Commissioners on August 20th, 2025 for the final approval and release for hire.
Good afternoon.
Shannon.
For the record, Shannon Ernst, interim administrator for Central Nevada Health District. So as requested, we went back and we completed the positions that were approved for the new org chart. We did salary comparisons across like communities, which is really extremely hard, especially when you're looking at these top positions. The first one you will see is the administrator/health officer. The goal of this is to bring these positions together so we can expand services and have a doctor under the structure and look at moving into jail medical and to build that sustainability. I did find there was an error on here. This new position is replacing the administrator position. So you have an increased cost of $56,582 for the wages and $36,926 for the salary. The total salary at a starting level 1 is $180,419 with salary, with benefit package right about $84,000. So the total cost for this position is $265,215. When you look at the next position, this is your Central Nevada Health Services Officer. It's a grade 1, step 1. Really, this works as kind of the deputy we're dealing with the daily operations. It's keeping everything moving. This is a new position, which results in a cost impact of $91,626 in wages and $50,751 in benefits for a total of $142. The next one, which is the last new position, is the Public Health Program Coordinator. This is a grade 47, step 1. This position really I have recommended to the board so that keeps your grants moving forward. There is somebody monitoring your scopes of work and helping the managers and the staff move that. I think this is a great position to add to the success of Central Nevada Health District. This one is a new position that the impact would be $50,646 in wages, $34,000 in benefits for a total of $85,231.69. Then we move into positions that we have looked at revising to really align with the organization structure since the 2 years. We didn't know 2 years ago what was needed, what was not, and what this should look like. So you have a revised clinical services manager, and this one used to be a standalone, and then we had an APRN. I will say Kathleen Patterson has done an amazing job on taking on that role, and she has agreed that we combine this. So we would have our APRN, plus she would be the clinical manager. There is no additional impact with this. Based on how the APRN salary was structured, it's just been combined. The next position is really splitting, looking at environmental health specialist 1 and 2. When you look at other health departments, you really have that trainee position. They're either called a trainee, which has kind of been thrown out of the straight structure, and they call them a 1. So somebody comes in and they're not fully certified, they should start at that 1 level, and after the 2 years, when they gain their certifications, then they would move into the 2. So you're not adding positions, you're just adding extra areas for growth within the organization and allowing people to come in and be trained. The next one is the public health investigator. We talked about the fact that really we needed a phlebotomist. Our investigator is a phlebotomist, and when I was talking to Northern Nevada Public Health, they actually include a phlebotomist is recommended for a public health investigator, which was very exciting. So we've added that caveat in there, and this will allow us to remove a contract that was put into place to work with New Frontier Behavioral Health Center. Now you would actually just have the phlebotomist in-house, and we would pay up to 25% of our time would be covered by another grant or contracts from outside. And the last one is the public health preparedness planner. We are small. We cover 650 miles and less than 36,000 people. The miles is long, but the amount of permits that we have is not large. So we can really utilize our staff when they're out doing LEPKI meetings, those things. This person becomes an inspector, and so about 25% of their time within that area are now able to conduct those inspections, and we're not having to send somebody else out for one inspection. And so there is no effect with the cost of this. It's just change in job description. If there's any questions, I can answer.
Okay, thank you, Shannon. Is there any questions of the board of this agenda item?
Mr. Chair. Jim Barbie for the record, recovering former county manager. Question, and putting you on the spot a little bit here, so I apologize, but just as we're going through this list, it struck me with the positions that are being merged, and just ballpark, not an exact number, with the positions that are being merged and staying the same, what do you think the net increase in salary costs is going to look like under this structure, roughly?
You're really putting me on the spot, ex-county manager, Barbie. No. When you look at this, your impact is less than about $150,000.
And I just wanted to draw that out because I think looking at the cost of jail medical on the counties, I think it's very reasonable that can be achieved in a new revenue source with this position and with this reorg and structure. So I think that's super beneficial. Obviously, I can't speak on behalf of the county, but I know up to 4 weeks ago, this was a significant issue in the county in Churchill, and I think there might be other counties that are interested in this benefit.
And that is correct. So I did speak to County Manager Spross and reminded him that this was kind of the goal, and to build that sustainable model and fill the gaps in these communities. The goal would to be look at mapping Churchill County adult detention first, to have that launch before July 1 of next year, sooner than later. It matters when you get an administrator on, right? We need a doctor in this position, but I will say that Jeff Weed and I have been evaluating this now for over 3 years, and we have an idea of the scope of work and how that could align. I've done way too much research on jail medical that I ever want to do in my life. But, so we would look at that piece first. Then with the county, Churchill County had to sign on with juvenile probation and their doctor to stay, so they were compliant. The goal would be that would be mapped out for next July 1 to kick in. I've been working with Mineral County. They actually approached me about the conversation. They also had to make a change. There's this pharmacy is the biggest thing there. And so next July 1, they would look at also wanting to join if we had this up and going, it was successful. The biggest part is I don't think we've added a lot. Is what we've done is we've realigned. So we're having removed salaries here and then the increase here. Now this is what I have quoted you today is your step 1. So if the board does come back and approves to hire an administrator at a level 15, that of course that cost will go up. One of the things I have found with Central Nevada Health District is most positions all came in at a level 5 or higher. So you have individuals that are almost at the top of those scales. So that has been a huge cost to Central Nevada Health District, and I urge you as you move forward, if I'm not sitting here to urge at it, really look at the experience and where they go as it moves forward. I believe in 2022, I had received authority to hire up to a level 5 for management positions. But this kind of happened all the way through the whole organization, with some people being hired as high as a step 11. And so this is something to really watch, because that's how your costs, personnel is your top cost. When you put those benefits in, it's not just that salary, but you look at those benefit packages. The average benefit package with under Churchill County is 46 to 56% of that salary. And we need to do better of educating the people that want to come to work for us. It's not just what you're getting paid, but look at this benefit package, 100% of your PERS, 100% of your medical. So these are things that I hope to have a chance to work with your new administrator as we move forward, because those aren't things that just normally come with it. So if there's any additional questions.
Well, what you have to tell your new administrator that as you hire them, because people don't understand that benefit package in the PERS system and medical. And the city is in agreement with that jail idea that the county brought forward, several weeks ago. So
Yes.
just so you understand that.
No, and I appreciate that, and I think it's a way, we need to look at filling the gaps in the communities. We have our core health services that really need to be done. We need to get strong in those within the health district. We need to be able to provide those to the communities, but then looking outside, and that's a huge piece for that sustainability.
So, Brandon Shattuck for the record. Shannon, for the health officer, the MD, how many hours a week or a month are you anticipating this position working? Because as I'm looking at the wage, I would bet if you got a really good deal, you're looking at no more than 8 hours a week.
So this position would be a full-time position with full benefit package. It's an employee of Churchill County on behalf of Central Nevada Health District. So they are an exempt employee, but that would be just like myself. They are a full-time employee. If you look at Northern Nevada Public Health, he is in the trenches. He is helping with the grants. He is supporting the staff across the organization.
It's possible I'm just entirely reading the wage wrong. So cost impact of 56,582 in wages.
So it is written incorrectly, sir, and that's what I kind of mentioned. I apologize, this was written by someone else. And when I was reading through it, so that is the increased cost. So the overall cost, you're looking at this, if it came in at a level 1, is $180,419 is the salary, which is a level 99, step 1. And then you would have an estimated benefit package of just under $85,000.
This is Jim, for the record, Barbie. So the example would be when this was posted, this would be a salary plus benefits wage of $265 plus $1,000. So it's a pretty significant wage.
Correct.
So the wage that you said, not connected to benefits, was 180.
Correct.
So that's about $86 an hour if it's a full time. Have you assessed the market to find it likely to find a physician at $86 an hour? Because I would love to know where you're fishing.
I did not. So human
find
resources.
that.
Sorry. I can't see you, sorry. Human Resources did the evaluation of these and the salaries for them. One of the biggest things is we have to look at other communities, government entities, so that we can align within the pay scales with all positions. And so this is where this came in for, it's usually with outside of Washoe County or an urban area, you have a reduction of 5% off of a salary to align. And so that's what she used for this market. And I'm sorry, Kim Brodsman is not here to dive in further on that evaluation. But like I stated, this is $180,000 at step 1. Within the government structure, there's up to 13 steps for this. So every step is 2.5%. And so I can't do the math in my head right now, but 2.5% at 13, that's the highest level of it. Including annually, you look at a merit increase up to the 13 level, and then if there's cost of livings approved by the governments.
Jim Barbie, for the record. And again, this would have been done through a comp study of evaluation of other, which is what Shannon said, and I'm kind of repeating it. But in other words, there's doctor positions that exist in current state correctional facilities, state mental facilities, other district areas that are fully employed with medical personnel. And so that's how they calculate the salary that comes out. It's through a comp comparison. The benefit, or the nice part that was referenced earlier, if you come from the state or a state entity to a position like this, you're instantly making 15% more because it's 100% PERS retirement system. So your take home every month is 15% more than you would be if you were making $180,000 at the state, just FYI.
Okay, thank you.
Is there any other questions I can answer?
Shannon, just to clarify the record, the clinical services manager and family nurse practitioner, you've got the salary and then you've got a benefit package of $25,000. That seems like it's unreasonably low percentage of salary. I think maybe that number needs
Yes,
to
it
be
does.
clarified.
I think that might be need to be clarified. But there would be no change to the salary for the individual that's in the position now.
Right. How about
So-
the benefits? So is that number correct?
No, there will be no change to that position, period. So
Oh.
you have an APRN that presently is doing that position, and it would just stay that way. And she's actually at a higher level. She's at a higher step. So there would be no additional fiscal impact for that position.
My question wasn't the salary. My question was the benefits.
But there'd be no impact, period.
Oh,
No, across the board.
Okay, so
Because
that's an
basically you have
impact
somebody
figure.
that's making higher than this now.
Right, yeah.
And so there would be no change.
okay. I was just concerned that we were understating that number.
No, and I apologize,
Yeah.
that does look low, and these were put together by HR. I don't have the spreadsheet.
Any other questions? Being none, I'd entertain a motion.
I'll make a motion. This is Denise Ferguson for the record. I'll make a motion to approve the following positions, job descriptions, and salaries for the administrator, health officer, health services officer, and public health program coordinator, and also review the updated job descriptions for the clinic manager, public health investigator, environmental health specialist 1 and 2, and public health planner to support the new organizational chart and authorize human resources and the interim administrator to present all of these to the Board of County Commissioners on August 20th, 2025 for final approval and release for hire.
Do we have a second?
Second.
We have a motion and a second. All in favor?
Mr. Chairman, I would note to amend that and just add the statement with corrections as noted as part of the record.
Denise, will you amend that motion?
For the motion, I'll amend that to include corrections to either the base salary or the benefits as well.
Thank you.
Okay, we
Second.
have a motion as amended and a second. All in favor?
Aye.
Aye.
None opposed?
Aye.
None opposed, motion carries. All right, we'll go to item 10, consideration of possible action, development, and approval of the hiring process of the administrator/health officer. Shannon.
For the record, Shannon Ernst, interim administrator. So the goal is to really go to the Board of County Commissioners on the 20th, obtain the approval, and to get this out and posted as soon as possible. I would suggest that first goal is to get your doctor administrator on board and then move to the next 2 positions so they can be a part of that hiring process. So I have outlined a proposed structure for the recruitment for that position. I would propose that you open the position on August 21st with a closing date of September 3rd. We'd post this position in all local papers, state papers, and then use some ZipRecruiter, NACO, other partners that we have to get this out. The state has actually contacted me and said they would help put this position out. So that was great. Then we would look at contact the candidates on the 9th. Oh, we missed a spot in here. I apologize. So we would look at bringing all those in. It would close on September 8th. We would look at and go through, and if you were agreeance, it would be myself, the chair, and HR would review for eligibility for the position to make sure that they do qualify. Once that is determined, then we would take those top candidates and we would contact them for an interview. The goal would to bring this before the board during a special board meeting on September 25th at 1:30 p.m. for final interviews of the top candidate and negotiate for hire with the board. We want to weed it down as much as possible for the board so that you can make that final decision. Of course, we would have a backup candidate, 2 and 3, in case you decided not to go with one.
Can we meet all those timelines?
I believe we could. I would love to see that there's an offer made and negotiated at least for the new to start coming on October 9th or soon after.
Okay. Any questions for Shannon on this hiring process? If not, I'll entertain a motion.
Mr. Chairman, Jim Barbie for the record. I would move to approve the developed hiring process of the administrator health officer.
Second?
Dawn Witten for the record. I second that motion.
We have a motion and a second. All in favor?
Aye.
Any opposed?
Aye.
None? Motion carries, and we'll go to item 11, consideration and possible action concerning review of a media campaign sponsored by the state of Nevada through NACO for CNHD by KPS3. Shannon.
For the record, Shannon Ernst, interim administrator. So we had a unique opportunity, really. There was funds remaining that needed to be expended by the end of June. And so we were offered up to $150,000 for a media campaign to use now and for the future. This was completed, and as what we'd like to do is show you a few things that came from this. Amber?
Rural Nevada runs on hard. We work hard, we watch out for our neighbors, and we don't quit when the going gets tough. Central Nevada Health District, that does the same. They live here, they know our way of life. But we're taking care of our families in the land. They're working to keep people in our counties healthy. CNHD provides essential services like immunizations and community clinics to keep our kids in school and us out of work. They test our water, inspect our food, plan for whatever might be coming down the road. They stay 2 steps ahead so we can keep showing up. For ourselves, for our friends, for our family. Because our heart is as strong as our backbone. CNHD.
So that is the video that is being placed currently. It's just going up at Fox Peak Theater here. We'll be able to use it. We have it in 60 seconds, and then we also have it in a 30 seconds so we can meet all those. The next thing we really worked on was, let's make sure it's this one, our billboards. So there's a billboard located in Hawthorne. There's also 2 here in Churchill. Our goal is 1 here in Churchill moves actually out to Lovelock once it comes available. We missed it by 2 weeks. We waited for the grant funder. So we have grant funds that are paying for those billboards, and these been provided to us at no cost. This is the first one that's gone up. We really want to highlight kids vaccine and going back to school. The next one will be, oh, it's on the wrong one. You didn't get to see it, just kidding. Let me go over here. All these screens. You gotta drag every time. So here it is. This is the first billboard that went up. And it's not going to open the second one. So the second one highlights environmental, and it's actually somebody out in the community for the inspections. And that one's not going to work either. We had a terrible time. These are huge, so we could not put them on flash drives. The last thing they really worked on was having a media playbook. We want to make sure that we have resources for all staff when you're putting things out onto social media. So there's templates. Throughout this, it has different things if you're doing inspections, how you can highlight for education. It has event offerings. It has testimonials, so if we get these, we can put them up. So it's really easy just to plug and play so that we're using standardized media to really get Central Nevada Health District out there. I actually got the honor of going to Lovelock last Saturday. Our public health planner was not available, so I went out and talked to individuals about clean water after an emergency. And one of the things I did find was they didn't know that we were there. And so as part of my opening, I talked about the creation of Central Nevada Health District and how we have locations in every community and where it was located there. And it was really engaging, and it was nice for them to see and be alarmed. So we do need to get Central Nevada Health District out there. Let them know what the services are. KPS3 also did a news release. And this is a draft, and it's also in your packet, talking about the health district and how it brings care to our rural communities. Within that packet, it shows everybody that was contacted with it, and they had gotten some feedback. And so there's some copies of where it was posted and where it had been broadcasted on our behalf. So this is just one of those things I wanted to show that came to the table. We took the opportunity, and it's out there, and then the team will be using this to use as we move forward. If there's any questions.
Okay, any questions? Thank you, that's good. Really well done, I think. Okay, we'll go to item 12, consideration and possible action concerning review and possible approval of Consilium agreement to provide clinical staffing during coverage shortages to be approved based on actual rates charged. Shannon.
For the record, Shannon Ernst, Interim Administrator. So this contract just brings the opportunity to the table. You don't pay for the contract. You have it there in case you encountered an emergency or staff shortage. And then you let them know which ones you need, and you pay based on those rates. In evaluating when things, you don't know when an emergency is going to happen, right? The more things you have in your toolbox, I think is a great thing. And so this would be an opportunity to have that at the table in case we had a shortage of nurses, we did need additional doctors, we would be able to do that contract and bring those forward. So it's just a safety net in our toolbox. No cost.
Okay, any questions for Shannon? Any public questions?
For the record, Denise Ferguson, I think the only question I have is, the rates look, like to par. Do they have a minimum? Like, are you set like some of these other organizations where you're committed to 8 or 12 weeks, even though you may only need somebody for 2 weeks?
No, he said
Okay.
it's as long as we needed. Just like he talked about, I guess it was in Southern Nevada, he placed someone for 2 days. They had that, and it took them only it was easier in Southern Nevada to get somebody placed within 24 hours. But he says he does, like they had somebody that was available to go to Lovelock. He texted me and said, do you by chance need someone in Lovelock? No, we don't need anybody. But, so they're trying to build that network for Nevada, especially in rural.
Okay, thank you.
Thanks, Denise. Okay, if not, I'll entertain a motion.
Mr. Chairman, Jim Barbie for the record. I would move to approve the Consilium agreement to provide clinical staffing during coverage shortages to be approved based on actual rates charged.
For the record, Denise Ferguson, I'll second.
We have a motion and a second. All in favor?
Aye.
Aye.
None opposed? Motion carries. We'll go to item 13. Consideration and possible action concerning ratification of agreement between Central Nevada Health District and the State of Nevada Department of Public and Behavioral Health for the Public Health Fund approved during the legislative session in the amount of $96,044 per year, fiscal year 26, 20, and 27, totaling $192,088 for the biennium. Shannon.
For the record, Shannon Ernst, Interim Administrator. So previously, this fund was known as SB 118. This did change during this session, and now it's the Public Health Fund and has been placed in the governor's budget. What happened is we put our contracts forward. We decided to do it as a memorandum of understanding rather than a grant award. This allows flexibilities to the health districts because we can determine what is best suited under the priority and submit that budget. So we'll be working on that next week. This was approved. There is a change. It is now not just one lump sum over the 2 years. You get an allotment per year. You have to utilize those funds, show how you expended those funds in that year, or you do not receive the next allotment. It does make sense for accountability. Last week, I presented at BOE over this, and it was approved by BOE, and now you will see we have a fully executed agreement that went into effect yesterday for expenditure. So this is just a ratification for you, sir.
Okay, any questions of Shannon on this agreement? Public questions? Back to the board for a motion to approve.
Mr. Chairman, Bob Erickson for the record. I move that we ratify funding between the Central Nevada Development District and the State Department of Public and Behavioral Health for public health fund approval during the legislative session in the amount of $96,044 per year, fiscal year 2026 and 2027, totaling $192,088 for the biennium.
Do we have a second?
Second.
We have a second. All in favor?
Aye.
None opposed, the motion carries, and the agreement has been approved. We'll go to item 14, consideration and possible action concerning ratification of a lease between CNHD and Eureka County for the space located at Eureka County Clinic at no cost. Shannon.
For the record, Shannon Ernst, interim administrator. Previously, we had a location, it was at the airport in Eureka, and it wasn't found to be really where people wanted to obtain services, but it was set up during the pandemic. During discussions with Eureka, they really want to see expanded services with family planning, vaccines, immunizations, things of that sort, and it was explained we really truly need a location. So they were able to locate a space for us within the clinic so that those services could be offered. I'm working with our APRN, Kathleen Patterson, to develop a schedule as we can go there. The next step is that we need to get staff. The position for the resource liaison should be coming up for posting here shortly. Once we have that timeline to get somebody onboarded, we'll make sure the clinic gets set up and make sure that then Kathleen and Amber can use it there. It gives us a presence, and so we're very excited about that. Any questions?
Are there any questions for Shannon? Anything from the public? Back to the board for discussion and/or motion.
For the record, Denise Ferguson, I'll make a motion for ratification of the lease between CNHD and Eureka County for space located at the Eureka County Clinic at no cost.
Jim Barbie, second.
We have motion and second. All in favor?
Aye.
None opposed? Aye. None opposed, the motion carries, and the lease has been approved. Item 15, consideration and possible action concerning written submission of the amended bylaws of the Central Nevada Health District Board of Health.
Mr. Chair, Jeff Weed from the District Attorney's Office. Interim Administrator Shannon Ernst asked that I present on this one. She and I met and went over the bylaws, and I guess I'd call this just a cleanup of the bylaws. There's a few minor changes. They require that a written submission be brought before the board the meeting before they're actually amended. So today, there's no request for amendment. It's just for review. I know there's a proposed motion provided. I don't think a motion is actually needed. These are just to be submitted to the board. But there's some minor changes to kind of bring them in conformity with themselves and with county code. For example, in section 4.3, it provides that the district shall choose that 11th member of the board who's the physician licensed in the state of Nevada. It previously provided, or it currently provides, that a committee would do that. The board can obviously do that, but it just takes the requirement that happen through a committee out. The board could still opt to do that. Section 4.5, it had that board members shall serve for a 1-year term, but the county and city codes adopted by the members individually or provide for a 2-year term. Again, down in section 5.3, it said that the elected officers of the board shall serve for 2 years, whereas it calls for an election every January, so that's amended down to each January that election would happen. And so there's just some changes like that throughout, and so I'm happy to answer any questions. But other than that, I don't think a motion is required. It's just submitted today and would be on the next board agenda for approval.
Why do those have to be one-year terms?
They don't have to be one-year terms for the officers, but they're in section, let me make sure I get them right here. Section 5.2 calls for elections of officers each January. And then there was this provision that it would be every 2 years, and so that it appeared to be in conflict with each other if there's an election every January, but they're serving for a 2-year term. So it could be they serve for a 2-year term, however the board wants to do that. In talking with Ms. Ernst, we elected to go down to they'd serve for 1 year, they'd be elected each January. It could be the same person, a different person, but however the board would want to do that. But anyway, it's not required to be the 1 year, but just to bring it in conformity with itself, that was the option that was taken.
It's kind of an issue because, like, I appoint and the council confirms who's a member of this board. So how are you going to handle that?
So, sir, he's referring to the officers of this board. So you would have your election for your chair, vice chair.
Oh, okay, I get it.
Yeah.
Okay, yeah.
Those currently are yearly, but they're supposed, it says that they're 2-year terms, so they don't jive.
Yeah, okay. 'Cause you can't really say you on this board or not. Are these staggered terms? That always bothers me on these boards. You know, Bob and I ran into that with a nonprofit we were trying to help one time, and every year their whole board changed over, and all the new guys never knew what the heck was going on. And then Mike Mackin finally redid their bylaws so that they were staggered, so.
Well, you're
that isn't-
staggered now.
You know, that isn't even
What's happening?
possible here because,
It's-
you know, I make the appointments, the council confirms them every year anyway.
So-
Every January.
So the letters come for a 2-year term. So previously, so when we started in 2022, everybody except for Eureka was appointed because this was the original members. Eureka's appointment came in 2023. It was June of 2023 because we had to wait for change of legislative. So those two. So they were 2 years from June, and this has been a lot of fun to go through. But then you had a member that stepped down from the board because they were no longer a commissioner. So it came in, and how the wording was done, theirs was going to expire when the original term was up. They changed, I'm looking at Jeff so he can confirm, because this has been very confusing. So the new appointment of that commissioner in that county was for a 2-year. So everything started staggering where they're at. We found we had some officers that actually expired a few months ago, and so we've obtained letters of reappointment for those individuals. We've asked that they do them on a 2-year term based on the that expiration. So Churchill County appointed, I was in position, Dawn came in and took my spot on the board. It was 2 years from that date, so it does not expire on that same January. County Manager Barbie left when he was county manager, and previous Commissioner Olson was placed. Then he resigned, and County Manager Barbie came in for a 2 years from that date. So now you've got some staggered turns that have automatically happened.
Well, I thought about those, you know, like
should
they
put
weren't
my map-
filling
my
in for the
chart.
remainder of that term. They were filling in from that date.
Mm-hmm.
We just have to, because of how we had to all be sworn in again, we just have to remember those dates. Everybody's swearing in dates, you know.
I think we make the health district director mandate that they remember
Yeah,
those
oh, yeah,
dates
no
and line
question.
us out.
That was going to be my request, because I think mine did expire and we had to request or something or whatever, but
Yeah, we're
We
We
not
have a
gonna
chart
remember.
now.
'Cause I was
that
like-
aligns.
if you just go to the county and ask them, that would be great. It'd be a lot easier.
Let's make it Jeff's job.
Yes, so we actually took and we submitted letters, many counties received letters requesting new appointments, and it can confirm the current position or add somebody new. We got those letters, but we have developed a chart that I will hand off to the administrator once they're appointed, that shows when those all align so that they can calendar and make sure that they get those appointments at least 30 days prior. For the health officer position, that obviously had expired also, but it does state until there's a reappointment made, so Dr. Heath is still on the board. But we did post for a new health physician representative for that, and we have received a letter of intent as of this morning, letter of interest, excuse me. So the next board meeting, we'll be bringing that forward for confirmation for the board for a new representative.
Okay. Thank you. All right, we'll go to item 16. Consideration and possible action concerning approval of the Burning Man release waiver of liability and volunteer agreement for volunteers assisting with temporary environmental health permit inspections and/or operational and logistical support for Burning Man 2025.
Thank you, Mr. Chair. Jeff Weed, for the record. Again, Ms. Ernst has asked me to present this and answer any questions that may come from the board. As the board knows, Burning Man is quite the event and requires a number of volunteers. And so together with the interim administrator and with Maria, our environmental health manager, we compiled this agreement for those volunteers to sign. It can be challenging because they engage in different capacities. Some are environmental health specialists, others are just kind of logistical volunteers to help with handing out permits, helping set up tents, preparing those kind of things. And so this agreement is an attempt to kind of consolidate that into one. It'd be presented to each volunteer, detailing what their services are and what capacity they're volunteering. Then in exchange, they receive admission to Burning Man as a volunteer for the health district. They receive housing and food equivalent to that is received by the employees of the health district. And so this just sets forth those terms and conditions for them to utilize during Burning Man this year.
Shannon tells me they have quite the housing already planned out there.
Well, I think
I don't know what y'all need to reimburse for him, Red.
Jeff's to be commended because I hear he's volunteering as part of this to be out there to really learn from the ground up on this activity.
I don't even need free entry. I'll just be there.
I'm right behind Jeff. Yeah. We'll be in an environmentally controlled building when we go out there. Okay, any questions or comments on this? You want a motion to approve this, right?
Yes, please.
Okay. I'd entertain a motion to approve this release.
Mr. Chairman, Jim Barbie, for the record, I'd move to approve the Burning Man release and waiver of liability and volunteer agreement for Burning Man 2025 as presented. Now, by this motion, by labeling it through the year, does that mean we'd have to come back and do another one next year? Or should we make this, remove the year so this is the ongoing?
I
Doc.
think it would be just for this year. I mean, we kind of did this in an expedited fashion. I think we'd want to review it for years
I
coming and
maintain
see
my
how it
motion.
goes.
Thank you, Chair.
Yeah.
Mr. Chair, Bob Erickson for the record, I second the motion.
We have a motion and a second. All in favor?
Aye.
Aye.
None opposed. We'll go to item, that motion carries for that release. We'll go to item 17, consideration and possible action concerning a fiscal report for FY25 and FY26, revenue, expenditures, and grants. Shasta, it's all yours.
All mine. For the record, Shasta Garrison, Grant and Fiscal Specialist. I think I have my stuff in the same order as you. The first sheet that you guys should see is the fiscal year 25 grant data outline. So it's just a quick overview of all the grants that we had for the entire fiscal year and where we left off with them. There are a couple that carry over into FY26. The grant period is different than the fiscal year. So we're still expending on those. And then, I don't know if yours is in color. Those ones are in red, I think, on the ones on the original sheet. The next sheet is our FY25 revenue report. So with all inspection fees, community health nurse fees, and of course grant revenue, we received just under $2.8 million in revenue. Inspection fees, I don't know why the budget's not on here, but we had budgeted $100,000 and we actually received 153, so we were quite over budget there. And same with community health nurse fees. We had budgeted 5,000 and we came in just under 15,000 for the year, mostly due to becoming in contract with several insurances. For expenditures, our proposed budget was just under $3.8 million. Our actual expenditures was just over $2 million. So we came in under budget about $1.8 million. For FY26, the next sheet is the data outline. Those are, so all the grants with budgets over on the, in the last column are the ones that have carried over from FY25. We do have 2 that we applied for that the applications are still pending. Unfortunately, the state, federal government, I think, are just kind of behind in announcing those awards. And then the others are just pending execution within the state system. They're in process. They just haven't been fully executed yet. And then the next 2 are the revenue and expenditure for FY26. We're obviously only a month into it, so there's not much data there, but it's where we stand at the moment. Any questions?
Hi, Shasta. For the record, Denise Ferguson. Thank you. I think that financially it looks pretty darn good, actually. The only thing I bring up, and it may be a question you can answer, but it might be actually for Shannon or the clinic manager. So the state's going to a Medicaid HMO program, which a lot of your patients probably are under that program, and it's going to go to that January 1st. Have you connected with those 2 aligned contractors? Because I know it does take 3 to 4 months to get that process going, and since you guys have gotten some progress in the insurance arena, I wanted to make sure that they've contacted you. There's a couple, sometimes they've been behind. One of them has been pretty much behind. So I'm making sure that we're not going to be shortfalled in that.
For the record, Shannon, interim administrator. So I had been working with Silver Summit since before they put in their quote. So we had a good relationship. They came out 2 weeks ago. My weeks are starting to blend. I think it was 2 weeks ago. And Kathleen's been able to confirm that we are with Ambetter and Silver State already. So that's going to be a smooth transition. We don't have to do anything with that one. We do have a meeting with CareSource next week. Finally, we were able to make connection. Amy from NACO helped us get in contact, so they will be here next week and we'll talk about what that looks like.
Okay.
So yes, we are working forward with that.
And I would push that group. We have found that since they're not originating here, that it's been harder because they don't have a workforce. So they're creating a workforce, but they're using the Prominence network. So if you're not in Prominence, that's going to be one obstacle. The second is they're using the Verisys credentialing agent to get credentialed. And you have to credential every provider that you bill for through Verisys. And so they should provide you those links in the next 10 days. And if you don't have it, you can reach out to me. I do have them. So you can just email me. I just bring it up because the timeline takes about 4 months and they're kind of at the end of it here. So
Yes, that one has been hard, you know, through this whole, when the bid processes were out, a lot of us reached out. Yeah, a lot of them reached out to us to talk, and we negotiated actually some side contracts. We were able to launch our telehealth center at the Life Center with Silver, but we had never heard of this one. So it was very shocking when they were approved because I hadn't even heard of them. So we hope to build a relationship also there. So
Yeah, they
thank
have-
you,
they
though.
have
We
some
will
really
be
nice
reaching
ben-
out.
Yeah, they have really nice benefits, but it is just the infrastructure right now that I think I can be happy to send some resources your way.
That would be amazing. Thank
Okay.
you.
Okay, thank you. Any other questions? Being none, I need a motion to approve this financial report.
For the record, Denise Ferguson, I make a motion to approve the fiscal report for fiscal year 25 and fiscal year 26 revenue, expenditures, and grants.
We have a second?
For the record, Dawn Witten, I second the motion.
We have a motion and a second. All in favor?
Aye.
Aye.
None opposed, the motion carries, and the report has been approved. Thank you. We'll go to item 18, staff reports, review of departmental staff reports. Shannon.
For the record, Shannon Ernst, Interim Administrator. First, I would like to kick this off, and I would just like to recognize the team. There was actually a paper written about H5N1, and our team was quoted in there, specifically Victoria Suffolk and Sharon. So I wanted to, and the report is here. That is very exciting for something that nobody knew what was going to happen, and they came together, and to be a part of this paper and have it published is amazing. Next, we will have I was going to make her present it herself, but I decided not to. Next, each one of our managers will come up and provide you an overview of really what they've been doing within their areas. I found that this has been very beneficial for the board to hear directly from them of their outcomes they've had. And I don't know who wants to come up first. They're all hiding today. And I did not provide you an administrator's report this time. I think you can see what we've been working on, and so I didn't think you needed me to bullet point it out for you. So, Victoria. Yes.
Thank you. Hi, good afternoon, Chairman and members of the Board of Health. My name is Victoria Sepsic, and I manage the epidemiology program for the Central Nevada Health District. I would like to start off with my epidemiology update for July 2025 by telling you all thank you so much for your dedication and your support for everything you do for the health district. I will keep this short because I know this has ran a little long. So I gave a update for July 2025 for our reportable conditions that we investigated and confirmed with our team. I kind of listed everything separately, so you can see our STIs that were confirmed and reported. We investigated 6 cases of chlamydia, 2 cases of gonorrhea. Our general communicable diseases that we had in our counties, we investigated chronic hep C cases. We had 1 case of IPD, which is invasive pneumococcal disease, 1 LTBI, 1 cryptosporidiosis, 1 salmonella, 3 cases of Q fever, which I will touch base on in a second. We did have some adult lead poisoning cases that we investigated, and our COVID cases that we investigated for July was pretty on par. COVID is kind of a year-round virus now. It's not really following respiratory norms of the flu season. So the epidemiologic considerations that I wanted to discuss with you guys today is Q fever. I'm sure you probably have heard it a little bit. We've talked about it some on our social media pages. We are monitoring an increase in Q fever activity in Fallon with 3 confirmed cases reported for July. For comparison, there were only 3 cases of Q fever reported for all of 2024 for all 4 counties together, making July a pretty notable rise. Currently, we are investigating 6 suspected cases also from Fallon. They are currently under investigation. We are awaiting some laboratory results to determine if they meet case definition by the CDC. At this time, there's no epidemiologic link between any of the cases. There's no commonality between any of them. Q fever is a zoonotic disease which primarily affects individuals who live or work near livestock, such as cattle, sheep, goats. The bacteria is shed in animal urine, feces, milk, and birth products. And humans typically become infected by inhaling contaminated dust or aerosols. Transmission can also occur through direct contact with infected animals or by consuming unpasteurized dairy products. Although person-to-person transmission is extremely rare. Q fever can present in 2 forms, acute and chronic. Acute Q fever usually presents suddenly with symptoms such as high fever, severe headaches, fatigue, chills, muscle aches, cough, chest pain. Chronic Q fever is much less common but is much more serious, typically affecting the heart, such as endocarditis, liver or blood vessels, and can develop months or years after initial infection, requiring long-term antibiotic treatment. Q fever does not usually lead to outbreaks. It can be presented in localized clusters or in regions where exposure risks are higher, which it is higher in Fallon. Some areas may be more endemic due to environmental conditions, agricultural activity, or proximity to livestock. The fact that all current confirmed and suspected cases are from Fallon suggests a localized cluster or a possible environmental exposure. So what our team is doing right now is we are interviewing all confirmed, probable, and suspected cases. We are investigating the potential sources of exposure, collaborating with the state's health department, other local health jurisdictions, and our environmental health staff. We will continue to monitor the situation and provide any updates as more information becomes available. Any questions?
Questions for Victoria?
Okay, thank you.
No, thank you.
Good afternoon, members of the board. And Mr. Chairman, my name is Maria Menjivar. I'm the Environmental Health Manager for the Central Nevada Health District. I will be giving the environmental health update as well as the public health preparedness update. So I'll start with the environmental health update. We went ahead and implemented a regulatory compliance inspection letter. And so we're starting to partner with our operators a little bit more and trying to be transparent in our violations on our inspection report forms, just to be a little bit more clear. Last month, we did close 2 establishments. We completed 30 inspections, investigated 10 septic system complaints, and conducted 11 temporary event inspections. A little bit of an update for Burning Man. These numbers were correct as of last month. However, today, it's a little bit different. So we did accomplish to receive 358 temporary event applications for Burning Man. We did close that as of last Friday evening. And we're still having ongoing meetings with the Burning Man organization just to ensure that we're all on the same page. These are a list of some temporary events that are coming up. So I went ahead and listed a few that we will be participating on. Namely, I did perform the inspections for the Eureka County Fair. We have the upcoming Fallon Community Day. We did have the Fallon Community Day, but we will have an upcoming Cantaloupe Festival, which we will be performing inspections on right before we leave to Burning Man, which is next week. I did provide an update of some unpaid health permits. As of the posting of this agenda and this report, we did receive a few other paid health permits, so I did want to make sure that I noted that. The Environmental Health Services team is in the process of evaluating and revising the environmental health fee structure. I just wanted to provide a little bit of information about that. We want to be committed to transparency, and some more details will be provided in the next meeting with regards to what that looks like. So I don't know if there's any questions for the environmental health update before I move on to the public health preparedness update. Okay, moving on. So the public health preparedness update, I did want to go ahead and say that in the month of July, we, as an internal CNHD staff team, there was a training that was conducted for ICS, just to make sure that we enforce that familiarity with the team on emergency response roles and procedures as it's outlined in NIMS. We did conduct a point of dispensing tabletop exercise as a team as well, which was very fun. It was a tabletop exercise where we focused on coordination, efficiency, and operational logistics. As far as resource enhancement, the CNHD Public Health Preparedness staff was able to acquire an emergency preparedness trailer through our grants. It's a 20-foot trailer, and this trailer, the main intent for it is to support emergency response efforts for CNHD and the district at any time for a response. Planning and coordination, we are still ongoing with scheduling and hospital partnerships for our flu pods, and we have been able to finalize all of those dates. So we're really looking forward to back to school and October flu pods. And we are still continuing that presence and partnership and collaboration at all of our LEPCs and throughout the district. And then I also want to support and provide the kudos to epidemiology team. The PHP staff was also able to participate and provided significant contributions to the H5N1 outbreak investigation and partnered in these collaborative efforts. I also want to mention that the Public Health Preparedness Planner significantly contributed to the environmental health inspections during the month of July, helping us accomplish and meeting our goals. And that's it. And I'm happy to answer any questions if there are any.
Does the board have any questions? Okay, thank you.
Thank you.
Thank you.
Two more reports. Yeah. Okay, thank you. There you go.
Hi. Hello, Mr. Chairman and members of the board. My name is Kathy Patterson. I'm serving as the CNHD clinical, I am the CNHD clinic APRN and interim clinical services manager. I'm here to give you an overview of the CNHD clinical services with our July update. I think you have the report. It shows our numbers of patients that we served in the clinic, the family planning and cervical and breast cancer screening patients, and then also the RN with the immunizations and TB screenings she's done. The numbers are actually up from June, but looking back at last year, we had the lower numbers in these summer months, and they increased again in the fall. You can see the community outreach we did, which was 6 senior center or life center visits, and those were in all 4 of our counties. And there's an overview of what we did during those visits. And then we completed our RN coordinator completed a audit of a family practice clinic who provides VFC vaccines, and another follow-up audit to the audit. We also got our CLIA-waived certificate, and so that allows us to do point-of-care testing in the clinics. And we're working on a medication disposal protocol. Those are just some of the highlights. Do you have any questions?
Thank you.
Thank you very
Could you
much.
tell me about the August back-to-school events?
Yeah, so, along with other people on our team, we are attending the back-to-school events in each county. So we went to Community Day here in Fallon, and we provided vaccine information on vaccines. We provided appointments or gave people information on where they could get their vaccines if they didn't qualify for the VFC funded vaccines. And so we're attending those back-to-school events in each county, doing the same thing, maybe not offering vaccines at each event since sometimes there's 3 events in one night and we just don't have enough.
But you didn't do any vaccines on site, huh? Just information?
No, we did, I'm sorry, we did provide vaccines at Community Day. And then we will in Lovelock, and we did in Crescent Valley.
When they have this big back-to-school at the 3 Cs,
That was Community Day,
That-
sorry, yeah.
but don't they have one like right when school starts in a couple weeks?
No, they're different events. So Churchill
do?
County Social Services started the Community Day event approximately 15 years ago.
Yeah, I remember that
And
one. but
that's the same one that was last weekend.
It's the same one?
Yes, and so it's now grown, now we have it at 3C. I think it was a little less numbers this year, it was only 680 kids and
What's the one
1,500
that
of
you
those.
could cook hamburgers at?
And then the high school will have, so the high school puts on one within our community. They do high school, the middle school, the junior, they all have a separate one that is information-based. And so vaccines are not provided at those. That's more of an information base, and they do it just the back-to-school event, the huge community day. The other communities have just one back-to-school event. They don't have individual schools having them, and so everyone is attending those also.
So the high school's having their back-to-school event at 6 PM on August 21st, Thursday next week.
And we will have individuals at those just giving information,
Information, no vaccines.
but they can make an appointment to come and see the nurses. You know, when you look at, we have 2 people that are eligible to give vaccines. To cover these events, we are really wearing everyone out. And so we determined it was best to cover the big events and then to take with these individuals, provide information, and schedule appointments.
Okay, I was just wondering. Thank you. Appreciate it.
Thank
It
you.
has been a challenge to cover all the events through July,
On this
August,
breast,
and September.
I'm sorry, I interrupted you.
That's
Go
okay.
ahead.
It's just been a challenge to cover all the events because it seems like we're having more and more of these back-to-school events, and to have staff to be at these. Some are at the night, some are on the weekend. Last Saturday, we had people in Eureka, people here. I was in Lovelock so that we could hit everything that day. So,
On this breast cancer, you discovered that on a visit to the clinic?
It was a breast cancer screening, so no breast cancer was detected, but it's a clinical breast exam, and then I do a referral for a screening mammogram.
So, but when it says 1 person for cervical and breast cancer screening, so did you detect it and send them for a mammogram?
I did, I gave them an order and sent it over, probably Reno Diagnostic is where I sent it. for
So,
them to get.
but you were in the chain here of helping somebody
Yes.
detect it so that they went and got help.
Right, it's a screening, so and they were eligible for screening, they were over the age of 40, female, and for the breast cancer portion, yeah. So it's recommended that women get screened every 1 to 2 years after the age of 40, until the age of 75.
Yeah, I'm really passionate about breast cancer. My best friend lost his wife, and, you know, I had 3 sisters and 2 daughters, and so we do like Pink Out at the high school. We pay for that and some other stuff for breast cancer, but yeah, I'm really encouraged to see that just 1 person that you found.
Yeah,
Yeah, thank you.
thank you.
Any other questions? If not, I think we're on your report, Dr. McDonald. Thank you.
I thought I'd be really mean and maybe take like 30 minutes or something, but I'm
Yeah,
gonna
you could
go
sure
with the, Dr. Ted McDonald for the record. Thank you very
These people are all
much.
going to scatter and disappear.
Yeah.
on you.
Thank you very much. I've got my little outline of things here, just kind of going through the kind of a narrative of what's happening and from my perspective, and kind of the change in reporting that we're doing. I like that. I have to do less summary, don't have to make an executive summary. You get a chance to see all the folks that actually do the work here and get to meet them and understand that they have a passion for this organization. So I applaud the change in how we report, and I appreciate your patience and your questions. For me, a lot of the things that are interesting is our national changes. Some of us have been around long enough where we see these every 4 to 8 years, and I'm to the point now where my hair doesn't catch on fire, but I just say that's going to be interesting. There's a lot of things that are happening now in the way public health is being affected by the Department of Human Health Services and a lot of the drama and trauma that's going around. But what I find is, based on history and based on looking at things pretty prospectively, there's a lot of good things that are happening right now also. So it just happens to be focused when I start looking at public health, or today I was supposed to have a meeting, a CDC meeting on a national meeting for measles alert. It was delayed, time to be determined when it's going to happen, and it was an out of the blue cancellation. And there's been a lot of that in the levels where I'm at as far as looking at national information. There's a lot of misinformation, disinformation, and that's why I've kind of presented just here as far as the national. It's kind of, there's things that are going on, a reflex, there's checks and balances, and in the next 6 months to a year, we'll see a settling out of this. So the warnings that we've got going on, I wish I could spell salmonella better, but Victoria gave a good presentation on the Q fever. They've been keeping me alert on that. As they said, it might have been a nasty, bad windstorm 2 months ago that blew a lot of stuff around and people got sick. There's no nidus of infection. There's no one place where it seems to be coming from, and they're doing a great job doing it. I get to sit down and talk with Veronica once in a while in the office, and she's really blossomed as far as in her position. She is really excited about doing these things. She's very thorough, and listening to her, she's very kind. She provides a good representation of what the Central Nevada Health District is. So they all do. Being in the community and knowing a lot of people, I don't get negative feedback. And if I do, it's like, it's very seldom and it's very minor, and it's not based on anything we've done. It's just been disappointment where, like, somebody was too late to get a permit, and we were done. I did have a little bit of an answer for you, Mayor Tedford, regarding the students. Churchill County, back in the dark ages, which you probably remember too, is the hospital board did have deals with some of the kids from Fountain that were going to medical school. There was a group of them that they actually paid for some of their tuition, their room and board, with a contract stating that when you're done with everything, you will come back and spend so many years for so many years. And if you don't, then you will pay us back with interest. So it is something, and it still goes on now. I have, students are rotating through now through the rural outreach clinics who already have jobs, and they're second or third year medical students. So it's something that's there, and it is a very easy thing to do through some of the high school programs. The kids that are interested in going into medicine is to tap them there, is to start getting them used to the idea of, like, your community will support you if you come back and support the community. So it's a great idea. I appreciate it. Let's see. Kathleen Patterson and Amber Lewis really did most of the work on making sure our CLIA certification is up. Also, as we move into bringing on new testing, which we are looking at in the future, that they will be ready for that. They've already got their logs set up, so when the inspectors actually come in, we'll have all the checklists ready to go. And Dr. Packham stole my thunder on the $750,000. That was a real exciting day. First thing I did was I texted Mayor Tedford and let him know that, yay, we've got money, so it's real. And John and I talked a little bit, it's like, I came back to Fallon in 2006. And that's when I met John Packham, Gerald Ackerman, worked with the CEO of the hospital then. So we had this whole process of getting this project, and now, 10 years, 20 years later?
20.
20 years later, we've got a lot more in place, and looking at the perspective, we're in a better place to have a successful program now than we did 20 years ago. So I really believe this is going to work, and I'm excited for our community about that. And that's basically, I've looked at the application for the position for the health officer, and I've opted not to apply for it. Reason being is I'm kind of past being a full-time employee on there. The big thing is my time is important. I would be excited about doing the job. When I look through that, I don't quite qualify for everything. The grant stuff is always a scary one, but it matches up with a lot of the work that I've done in the past. So I believe that you can, if you can find somebody that will be able to do it. And in the meantime, until that person is in place, I will do my best to help and provide advice, legwork, and continue any process that the interim director would want to have me do.
Okay, thank you for that. Yes, appreciate that. We appreciate your service to all these years, Ted. Okay, with that, we have public comment. Any public comment? Being none, we'll go to item 20, the next board meeting. Do you have a date other than the second Thursday at 1:30?
Yes, so I would like to, for the record, Shannon, interim administrator, I'd like to recommend that we not have the meeting on the second Thursday, and because you'll have a special meeting to interview for your new administrator, and that would be on September 25th at 1:30. I would ask then if we had anything that was of urgent nature, we would bring it to that and have it after those interviews. And then I would then offer up to you to allow that administrator to have 30 days on there, and your next meeting not be until November 13th at 1:30.
Okay, so
September 25th and
you think there's not going to be a very full agenda after the interview, huh?
No, I
Okay,
believe we
I'm
could
good
hold,
with that.
we're not going to have anything urgent. I think we would be just fine.
That's fine. So the 25th at 1:30?
Correct.
Okay, 9/25 at 1:30. So you need to change your automatic calendars.
Amber will send out calendar invites to you tomorrow so that they are on there and the placeholder is held.
Okay, thank you. Being nothing else, we stand adjourned. Thank you.
Thank you all.